So seasonal allergies are allergies to pollens, and the reason that they're seasonal is that generally certain plants will pollinate only in certain seasons. So we think of trees generally pollinating in the spring, grasses generally pollinating in the summer, and then weeds generally pollinating in the fall. If you live in a more temperate climate, then that growing season will last longer and sometimes even all year. And so you'll have allergy symptoms only at the time when your allergen is pollinating. The nasal symptoms will include congestion, runny nose, sneezing, postnasal drip, and then because of the postnasal drip, sometimes a cough or clearing of the throat. Eye symptoms are traditionally itchy, watery eyes. In terms of skin, some patients will develop hives when they come in direct contact with certain allergens. Seasonal allergies are generally diagnosed by an allergist. The most reliable tool is going to be skin prick testing. They'll actually use little drops of the allergen and just prick, and within 10 minutes you can get an answer as to what you're allergic to. Some of our patients cannot get off their antihistamines in order to do a skin test, and so we can do blood testing as well. So avoidance can be really important with seasonal allergies. The idea is the allergens are outside, right? The pollen's outside, and you want to keep the outside. And the best way of doing that is to close your windows because the pollen can get in. If you get home from a nice day at the park and you're full of pollen, maybe take a shower, change your clothes. You can do a nose rinse at that time. And then your pets are another important factor. So if the pet rolls around in the pollen and then brings that into you want to make sure that you keep the dog wiped down, ideally washed once a week so that you're not exposed to extra pollen or extra dander at that time. There are several different methods of treating seasonal allergies. Allergy shots are the only thing that will reverse the allergy. Prior to allergy shots, we generally advise that patients try medications. We now have nasal steroids. In terms of the pills that are available, so over the counter we have several different antihistamines, things like cetirizine or fexofenadine. It's really nice to have these tools over the counter and available to our patients, but a doctor can really help you in terms of when to take which ones, what they're doing, what are the possible side effects, is there a better regimen, and really tailor that regimen to what would work best in your case.